Hey there, and welcome back. Today I'm diving into a topic that many of you might find all too familiar: how arthritis impacts your joints and some must-know facts. First off, let me paint a picture for you. Imagine trying to open a jar, climb stairs, or even shake hands, only to be reminded that your joints just don't want to cooperate. It's more than just an inconvenience, right? It's a significant barrier to living life to the fullest. Now, when arthritis enters the mix, things get even more complicated. So, what exactly is loss of joint function? Essentially, it happens when a joint loses its normal range of motion and strength. This makes routine tasks difficult, if not impossible. Causes: it can stem from injury, inflammation, or degenerative diseases like arthritis. The effects are far-reaching, impacting your mobility, independence, and overall quality of life. Now, let's talk numbers. Arthritis, which is an umbrella term for conditions causing joint inflammation, greatly ramps up the risk of joint dysfunction. Research shows nearly 90% of people with rheumatoid arthritis, RA, experience some level of joint function loss. And for those with osteoarthritis, OA, around 80% develop some form of disability related to joint dysfunction. But here's the thing: while people without arthritis might also experience joint function loss due to factors like injuries or aging, the severity and prevalence are much higher in those with arthritis. Without arthritis, joint dysfunction is typically localized and less progressive. In contrast, arthritis-related joint dysfunction is often widespread, progressively worsening, and accompanied by chronic pain and inflammation. Diagnosing joint function loss involves a few steps. Doctors will look at your range of motion, swelling and tenderness, and they'll take a detailed medical history. Imaging tests like X-rays, MRIs, and CT scans help reveal joint damage and inflammation. And lab tests? They're used to identify markers of inflammation, which is crucial, especially for rheumatoid arthritis. Now let's touch on life expectancy. The combination of arthritis and joint dysfunction can impact it. Chronic inflammation, especially in RA, links to a higher risk of cardiovascular diseases, potentially reducing life expectancy by up to 10 years. Common causes: they vary. Genetics can play a role, especially if you have a family history of arthritis. Autoimmune triggers, injuries leading to OA, and lifestyle factors like obesity and a sedentary lifestyle all contribute. Symptoms to watch out for include joint pain, stiffness, especially in the morning, swelling, and reduced range of motion. Autoimmune diseases like RA increase the likelihood of joint dysfunction. Inflammation over time causes joint destruction, so managing it is key. Typically, arthritis kicks in between the ages of 40 and 60, but it can occur at any age. Often, arthritis and joint dysfunction come with other conditions like cardiovascular diseases, diabetes, or even depression and anxiety due to chronic pain. So what can you do? A proactive approach is vital. Regular, tailored exercise helps maintain joint function. Weight management reduces stress on joints. Physical and occupational therapy provides strategies to cope with daily activities. And mindfulness or stress reduction techniques can play a significant role in managing symptoms. All right, that's it for now. Remember, understanding how arthritis impacts your joints is the first step towards managing it. Stay active, stay informed, and take care of those joints. Until next time, take care and stay healthy.